go ahead with my bio. I'm Dr. Josie Beug. Let's see. Oh my goodness, I won't go too in depth. I graduated from, I went to veterinary school because I had been working in animal shelters and working for veterinarians and in a veterinary clinic in Portland, Oregon. The vet there, I was his kennel person. He told me to go throw this box of books out in the trash because he was cleaning out his back room. Well, I don't believe in throwing books away, at least not until I start looking through them. And I found Dr. Pitcairn's Natural Health for Dogs and Cats tucked away in that book. And I was trying to decide what I wanted to do with my life. I'd graduated with a biology degree, and in the front page of that book, it said, contact the American Holistic Veterinary Medical Association. This was like in 1990.
You aren't
And
kidding
so,
me.
no. And so went home and called them up because I was just going in and bathing dogs and cleaning the, dirty kennels and everything else. I called them up and I was like, this is what I want to do for this is what I want to do with my life. And she's like, calm down. It was probably T Cart's wife, but she was like, now calm down. Are you a veterinarian yet? And I was like, no. And she's like, you have to go to veterinary school and then you can get out and do all of this stuff. So that was like this huge, giant mammoth Mount Everest placed in front of me. But I did. I applied to veterinary school. I moved to Wisconsin and I walked in knowing that this was what I wanted to do. And then I did a bunch of externships with some of the founding members of OVMA and everything. And now here I am. I've had a house call practice in South Florida for 25 years and
And you're
doing
still doing that, or you're phasing it out now.
I'm still doing that. I'm turning that into like a concierge model. So for people who are very dedicated and really, they'll put me on a monthly retainer fee to come and take care of their animals, and so that I can get really involved with the cases. And then I do online consults, and I'm taught a class online. I have a community online, which we do Tuesday night meditations if anybody's interested. And Substack is where I do a lot of writing. So if you want to follow me and you want more longer kind of written things like the topic we're going to talk about tonight, you can find all that written on Substack. So, and it's free. You give me your email, but you're not going to get slammed by a whole bunch of garbage from me. You're lucky if you'll see something once a month, So, yeah.
That's awesome. Well,
Yeah.
thank you for being here. You have been kind of the voice about Librela and what's it called, the cat version,
Silencia. Silencia.
Solensia. And
Yeah.
so it's been marketed to the veterinarians in the pet community as, I think, a monoclonal antibody. Is that what that is?
No, it's what have they marketed it as? Yeah, it is a monoclonal antibody. I'm sorry. It is a monoclonal antibody. I just had like a brain fart. But yeah,
No
it is a
worries. We're
monoclonal.
all tired.
It is a monoclonal antibody. It's a genetically they have these terms that sound really good, and I think people think of like monoclonal antibodies help people through COVID and stuff, but a monoclonal antibody is actually a man-made genetically engineered protein that they engineer to do different things in the body. Cytopoint is a monoclonal antibody. It binds to something that stops the itching in the immune system.
I
Um,
didn't know that.
yeah, cytopoint is a monoclonal antibody as well. The problem with, well, we can go into this, but
Go
later.
ahead.
Monoclonal antibodies are protein molecules. And the problem with injecting protein molecules, and vaccines are actually often protein molecules. So they'll slice up pieces of a virus or bacterium or proteins that are on the outside membrane of that, like we all know the spike protein from the COVID virus, right? They'll
Right.
slice those up and cut them up and put them into vaccines along with adjuvants so that our immune system will form antibodies to those pieces of the virus. So our immune systems are engineered to respond to foreign proteins.
It's just
So any
terrifying. The whole idea.
when
Just
you
listening to you, I'm hitting like this
so
panic
and
attack.
I'm trying to go back because I studied a lot of genetics. I almost went into genetics instead of into like other like biology of animals and stuff, but I love animals too much. So our immune systems are designed to respond to foreign proteins and make antibodies against those foreign proteins. So like when we have allergens and leaky gut, it's foreign proteins that leak from the gut into the bloodstream that then our immune systems respond to and make antibodies, which then create an allergic response. So when you take a foreign protein and inject it into the body, there is the risk of the body creating antibodies to that foreign protein. So if the protein is itself, an antibody is just a protein that is made to like
Combat.
a lock and key to bind to something else into in the body.
That's a
Okay.
great analogy. I love that.
So it's like a lock and key. So Librela was engineered to bind to a protein our bodies make called nerve growth factor. Okay. When it binds to that, it inactivates nerve growth factor. So nerve growth factor is no longer biologically active. Okay. So then you have an antibody, Librela, and nerve growth factor, the protein it binds to, you have an antibody antigen complex, which makes a bigger protein. It takes this size protein and this size protein, and you add it together, and then you get a large size protein. So that's important to know as well.
So
So
that would be inflammatory, wouldn't it be, on that side?
inflammatory, and we'll get into that. We'll get into that as well. But so what is nerve growth factor? Well, if we'll just go ahead, we have this large size protein. If you have a large size protein circulating through your immune system, it's no longer taken out by, you can form auto antibodies to that large size protein. So you could form an auto antibody to Librela itself. You could form an auto antibody to the large size protein. But usually the larger proteins, you get into a different part of the immune system where macrophages are activated and the complement system can be activated. Also, these large size proteins can be large enough that they get stuck in little tiny capillaries like the glomeruli of the kidneys.
Oh, wow.
And when they get stuck in those little tiny capillaries, you get glomerular nephritis and kidney failure and kidney disease. Okay. Now, if they activate like the macrophages and the complement part of the immune system, which everybody seems to have forgotten all the way through COVID, except for one scientist, this Japanese guy at Max Planck gave an absolute brilliant talk about how complement works. But complement, you get these large antigen antibody complexes lodging in different parts of the body and capillaries and organs. Macrophages come along and say there's this foreign body in there and it's pretty big and it's stuck. We're gonna like try to devour it and dissolve it.
Okay.
So macrophages release all these things to dissolve that protein, and guess what it does? It's like if there's enough of them there, it's like punching holes in the organs.
Oh, wow. And
Yeah.
and
So and that can go all the way to where dogs are bleeding out. Dogs are having autoimmune hemolytic crises. You end up with something called disseminated intravascular coagulation, where it punches holes in the organs, and you get bleeding, then you get platelet consumption, and then you get this whole entire cascade formed that pretty much there's no stopping it, even
oh
in
my,
an
that
emergency
is
situation.
that is like a slow, painful death. That sounds awful.
Yeah.
And it,
Well, I watched a Rottweiler die of it once, and I was working in a veterinary clinic and I was in a back office talking to a client on the phone, and through the door was this kennel, and this big Roddy was standing in there, and he all of a sudden he got up, he was really agitated, and I was on the phone talking to a client, and I saw him out of the corner of my eye, and then he got really agitated, and I looked over, and literally like blood just started pouring out of this dog's nose. He just like bled out in front of me, and that's just stuck in my mind. And he went into what's called DIC, which is the nickname for it is death is coming. If you get him early, I mean, they'll pump him full of heparin and pump him full of platelets and try to reverse it. But things like that happen. Things like that happen during COVID after some of that. But
Mhm.
so it can happen during any like autoimmune thing where the immune system, it just kind of devours itself in the body and everything melts down. That has happened with some Librela cases. People taking their dogs home and that night literally having like a bleed out episode in the middle of their living room.
That's
Yeah,
so bad.
yeah.
So, so this is why I reached out to you is I had two irises in 24 hours, dog and cat, I believe. And the dog one was devastating to look at for iridology. And I kept like asking the owner a roundabout way. I'm like, was it exposed to a toxin? Like, this looks like your dog's in
Oh,
really bad shape. And she's like, my dog is in really bad shape. And then finally I said, did you give Librela? And she goes, my vet did, yeah. I go, did they tell you the potential harm for it? And she goes, no.
they're not talking about it.
Why aren't they? I guess as pet owners, we have to be the ones that say, what's the potential harm? But would they even be open to that?
It's really bizarre what has happened over this injection because I've talked to many different veterinarians, and when I read through the whole entire FDA application and the package insert, and I have a document on my Substack going line by line where I have their exact wording, and then I have why it's a red flag in italics, and then in another thing, I tell my opinion of what's going on here. But most of it was legalese. What happened with that drug, this is what happened. They, well, first, nerve growth factor. What is nerve growth factor? Nerve growth factor was not even discovered until the 1950s by this woman doing research. We still do not understand what exactly nerve growth factor does physiologically in the body. It's kind of like an insulin. Insulin is also a protein, a peptide, but nerve growth factor, there's nerve growth factor in the brain, which I was saying Dr. Curtis Dewey did a lot of research on at Cornell. And then there's peripheral nerve growth factor. Now, when they first discovered nerve growth factor, I think it was back in the early 2000s, they were like, wow, we've got this nerve growth factor. We know the things they do know is that it maintains homeostasis in the nervous system.
Okay,
It helps the nervous system repair itself, and it's involved with neuroregeneration and plasticity in the brain.
cool.
So, yeah, it's very cool. So the scientists were like, wow, what if we started using this in some neurodegenerative conditions like multiple sclerosis and different things like that. Well, they tried it actually even in people and they had disastrous results. Like they injected pure nerve growth factor into people and just like meltdowns happened. It was really bad. Like you can go back. I went all the way back and looked through this research because I'm like, what is nerve growth factor? I didn't hear about nerve growth factor when I was a vet, but people don't even ask that. Like most vets out there have no idea what nerve growth factor is. They're just like, oh, Zoetis, oh, it's a miracle thing. They spent millions of dollars brainwashing vets, following them around their clinics, telling them this is a miracle drug. So nerve growth factor, we are learning what nerve growth factor does by using Librela and Solensia. So they since nerve growth factor itself couldn't be injected to help out people, what they did is they found out if they could have something bind nerve growth factor, it would take away pain because it's involved in these special TKR receptor things. It's very involved biochemically. So they got all the way, Pfizer and I believe it was Eli Lilly, got all the way up to stage 3 clinical trials in people. And they were running the stage 3 clinical trials in people when all of a sudden this rheumatoid arthritis panel of the FDA stepped forward and they're like, we're seeing this signalment happen, this thing like flag of certain people developing a rapid onset progressive arthritis, like in real time. They were doing fluoroscopy on these people, watching the bones become arthritic and disintegrate in front of their eyes.
Wow. So that's why it was a flagrant fail.
So, yeah, so the rheumatoid arthritis doctors were like, you got to stop these clinical trials right away. They were having to take these people in for emergency joint replacement surgeries because their bones were just completely disintegrating and dissolving.
Oh my
Yeah.
gosh,
Okay.
that's
So they
so horrible.
coined, okay. So
So
they
did they
coined,
repurpose this for pets
well,
because they
yes.
spent so
So
much money?
they coined that syndrome, rapid onset progressive arthritis, ROPA. And because they spent so much money, exactly, they throw it over into veterinary medicine.
Oh, that's what I
And
wondered.
in the package insert, it says, "Oh, we haven't seen any incidents of ROPA in dogs and cats." Well, the study that came out, it was last spring because it was the day I was at Dr. Judy Morgan's big event. And she was really nice enough. She gave me a corner so we could and I have volunteers who lost their animals to it. So we set up a whole table there just to get the word out for people. But the day we were setting up for that, what's his name? I'm not gonna, it's Michael somebody. He's an orthopedic vet in the UK. They published a study with 20 different board certified orthopedic surgeons and neurologists came out and they had evidence, they had CT scans and x-rays of rapid onset progressive arthritis happening in dogs from Librela. And you can
Oh,
see the pictures. I mean, it was all over the internet. So that same syndrome happens in dogs. But so you've got that taking away nerve growth factor plus Curtis Dewey, he came out and said that there is no doubt that Librela crosses the blood-brain barrier and gets into and binds to nerve growth factor in the central nervous system in the brain. So that's going to affect how the brain works. We've seen cases of sudden onset blindness. We've seen cases of seizures, like intractable seizures, where the dog ends up dying from the seizures. We've seen all kinds of central nervous system dementia. Like overnight, all of a sudden you wake up and your dog is staring in a corner and doesn't know where they are.
oh my gosh.
Yeah.
And this is still on the market.
And people are still recommending it. I mean, I wrote my first paper on it. It was in December 2023. We're in 2026.
Oh my gosh.
And so you have the arthritic changes, you take away nerve growth factor, so you get what I'm terming nerve growth factor deficiency syndrome, which is all over the place. If the other scary thing about that is if the dog has any underlying, we know as holistic people and homeopathists that the body is always trying to keep a state of homeostasis,
Right.
dynamic homeostasis. So if something's going on, the body is doing everything possible to heal it and keep things balanced. Nerve growth factor is a huge part of that for the nervous system. If you take that out of the body, if there are any underlying neurological weaknesses, degenerative myelopathy, intervertebral disc disease, like I said, dementia, any underlying weaknesses, it pulls the band-aid off and all of a sudden the dog is exhibiting those signs.
So it's
I've seen a
basically
shepherd,
kerosene and a match.
yeah. I've seen shepherds like all of a sudden over like literally 2 to 3 days, they're looking like they have degenerative myelopathy. but at a stage that would take like a year to develop naturally.
Rapid onset. Oh my gosh. This is
Yeah,
so terrifying.
yeah.
And the people that I know that have done it to their animals were not well informed,
No, there's
and they
no in.
trusted their vets.
Yes, yes. And there is no consent. And the vets are like, oh, but the rep, the Zoetis rep that was following me around, putting a bug in my ear all the day, annoying me, said it was perfectly safe. Do you go any further to look at what you're actually injecting? I just, and then in cats, it's the same problem with the rapid onset progressive arthritis. Plus, they're getting these horrific dermal lesions. You know how cats get like eosinophilic granulomas and gingivitis and stuff? Those types of lesions are showing up, but
Wow.
severe, like their skin is melting away.
Oh my gosh.
Yeah. So it's
It's like a
it's a
horror
nightmare.
flick.
It's
It's
it is.
it's
It is.
and
It is.
nobody's pushed. I mean, you have a petition, you have
Well,
advocacy.
there's two or three Facebook groups with every single day. I have to stay off of them. Every single day, more and more people are coming on with their animals. Some people are like, oh, but I've gone 4 to 5 years and nothing's happened. Well, guess what? The next time this is the horrible thing about it is some animals do okay for a long time, and then you go in and get that one shot that just blows their whole entire system out. So I think there's two class action lawsuits right now. I'm in touch with a person, Donna Pope, they lost their dog. Her husband's one of the lawyers behind it. So they're
Oh,
trying to get people you've got to file the adverse event reports with the FDA, and all that information is on their site. Two people early on that came to me, well, one, her dog was already dead. The other, they'll go into things like lockjaw. This poor woman was like feeding her dogs through a syringe because the dog couldn't open its mouth because the arthritis had hit the TMJ joint and the dog couldn't open its mouth.
so it basically finds where inflammation is and destroys
Where
it
weakness,
further.
yeah, where weakness is, any weakness in the dog. So, but they came together, and within 2 months, both of them worked in computer stuff. They put up a website. It's called petadvocare.com. I can put it in the chat.
I'll put it on
Um,
Facebook.
yeah, a bunch of really amazing people came together. There's a grief counselor on there because the thing is, and this is what just absolutely drives me nuts. I mean, the animals, it's hard enough because I've halted the progression of problems on some animals. Some animals have recovered. I put up a whole protocol, which is kind of like the whole kitchen sink protocol that's on petadvocare.com. So using as much lion's mane as you can get in your dog, because lion's mane stimulates the production of nerve growth factor, but it takes a lot. And then and some other things. I've
What
also
about
was using
ozone? Would
that may help. I don't know. I haven't jumped on the ozone bandwagon. I'm sure it would probably help. What I was using was proteolytic enzyme therapy.
Oh, I
So
love
you
that.
do high dose protease because the protease gets in the bloodstream and gobbles up
Protein.
leftover protein, the
Hmm.
proteins and the protein complexes, the immune complexes.
I think enzyme
So
therapy is highly underrated. Like, I don't think we understand it or use it enough.
most people don't, yeah, and it's not used properly. I mean, I've used it in some cancer cases. I had a lymphoma case and it shrunk the lymph nodes down and the dog's not on any chemo. So I've been using that, and all of that's in the protocol on that website. I was doing discounted consults for people with dogs with it, but honestly, it's like emotionally, I backed off on those. The frustration is just beyond, and there's they finally came out with they had to add to their package insert, and there's a certain syndrome, I call it Librela syndrome, where dogs will become severely ataxic. They'll have you flip they'll be walking on the tops of their back feet because they lose conscious proprioception, and they'll become severely there something's going on with the kidneys, which I think is the immune system thing, because they'll drink tons of water and they'll become totally incontinent, just urinating all over the place. And that all of those symptoms are very, very common in dogs that are having problems with it. um
You
yeah,
know,
and
I just had a client who was like, "Oh yeah, my dog just like pees everywhere," and I never even thought to ask if they were
Well,
Librela.
and here's the thing is that people are shamed. They go back to their regular vets and they're like, listen, this my dog wasn't having these problems since he got the Librela. And the vets will stare him right in the face and say, oh, it can't be the Librela. So all of these patient owners are the gaslighting involved in this to compound the trauma they're already experiencing with their animals. And then the shame, because you go in, you trust your veterinarian, and they're the person in the white coat. They're telling you there's not going to be a problem and it's going to help your dog's quality of life. So what are you going to do? Of course, if it can help your dog walk again, and then they blame themselves. And then the vets turn around and say, "Oh, it couldn't be that shot. There's no problems with it."
One, what I've also
It's
heard is, well, it was worth a shot because your dog had no quality of life anyway, and now they're gone. Like,
yeah.
I've heard
Can you
that.
imagine? Yeah. I mean, it's horrible.
Like
It's
they
painful.
they progress the death and that set the dog free,
That's a
so
good thing.
everything's
Yeah.
okay. Yeah.
And then there's some people saying, well, I wouldn't use it unless it was a last resort. Well, I'll tell you, if your dog has a last resort and they're whatever disease is going on in them that they progress to that point, there are numerous people online that are like, I would never want to see my dog die the way they died from this drug, ever.
How awful.
I mean, it's heart-wrenching.
Oh my gosh, Dr. Josie. So,
Yeah.
so
Yeah.
detox fires like NAC or DMG or bentonite or fulvic, do any of those things help?
I mean, and like I say, there's kind of the kitchen sink. I would go with all of them. A lot of people getting them on a really good diet, of course, we know is first and foremost, and stop the toxins, any more toxins from going in. But it's really tough, because if that rapid onset progressive arthritis starts, their joints are shot. They are just shot.
Oh,
Yeah.
that's just so heart-wrenching.
Yeah.
Oh my gosh, you guys, this is so bad. And
Yeah.
so, how do we get it pulled off the market?
Um, well, anybody who has had a dog that has had any problems with it, they've got to report it. And their vet doesn't need to report it. You can report it yourself. You can get the paperwork. And if you go petadvocare.com, they have all the forms and how to report it. You can go on the Librela sites. Well, the big, big Facebook Librela site, Facebook group, got somebody, they have bots and people working for them. This is Zoetis, you guys. Zoetis was the animal arm of Pfizer. Pfizer split off their animal arms so they could do exactly what they did with this. Gabapentin is another drug they shoved off after a $40 billion lawsuit on the human side. They threw gabapentin into the veterinary market.
And they even use it for horses. And I'm like, what?
Oh, it's,
What is the science
oh,
on that?
There is no science on it. The science on it is there's only a single study out there showing it proved it to do anything for pain. They've had force plate analysis studies, everything. It's just so that's another one. But I mean, that doesn't have as bad a side effects as Librela. But they've got they're making. I think they made over 123 million the first 6 months it was on the market in the United States. So we're talking billions of dollars. Now people on the Facebook, so they had somebody come on the big Facebook site group and said, "Oh, are on here telling people to give their dogs psychedelics to heal from Librela." So Facebook flagged the group, took the whole entire group down. I don't know. I think there was like 40,000, 50,000 people on there.
Oh my
All
gosh.
and so, but the lawyers that are doing the class action are talking to Facebook people saying you need to release this and get this group put back up there. That's bullshit. But we know it was somebody from Zoetis doing that stuff. I mean, there's
Wow.
been people that have been afraid to come out and talk about it because they're terrified of big pharma. Which in my mind, it might as well be like the cartel down in Mexico, you know? That's the way
Right.
they're
I
behaving.
mean,
It's
well, Pfizer, look at you.
yeah,
I mean,
yeah,
like,
yeah.
it's, yeah.
It's yeah. And then the amount of suffering that it's incurring though, I mean, the suffering of the animals themselves and the suffering of the people who love them is just untold.
But
It's
the,
just sad.
the ignorance and the arrogance in the pharmaceutical and the conventional vet world that just blows me away.
Well,
I mean,
I was
it's
telling
profit over pets at that point.
yeah. And I told you I went on the chief medical officer of Zoetis was having office hours to answer questions about Librela, and this was probably in 2024, 25. And so I signed up. I'm going to sign up for his office hours. I want to see what the man has to say. And we had to submit our questions ahead of time. And I don't even think he could see any of our faces because they just showed him with a big corporate Zoetis thing behind his head. And so I actually recorded it on my phone because I wanted a copy of it. But in that, somebody asked about, well, some of my clients are coming in with their dogs that had Librela saying they're walking funny afterwards. Now, the walking funny is because they're ataxic and their whole neurological system is screwed up. So they're walking funny afterwards. So his response to this question was, well, back in the days when we used a lot of prednisone, the dogs would go home and they would drink a lot of water and urinate a lot. So just tell them it's kind of like prednisone. They'll walk a little bit funny, but they're not going to be feeling any pain. That was his response
Wow.
to having a neurological gait on a dog after receiving their product.
I'm looking at the Facebook comments, and Natalie Fernandez said
Oh yeah,
her.
this is on Facebook. Good. Facebook.
It's a live stream. We're still on Facebook.
Good.
They didn't block me yet, which is amazing because I
Wow.
have been blocked off Facebook. But Natalie said that her dog had about 10 doses in 2024 before she knew better. The first one helped, the next one not so much, and then he started having fecal incontinence, and then his back legs gave out. It's a long post, so I don't want to read the whole thing,
Yeah.
but it was just,
Yeah.
and
It's
then,
such a common story. It's just
yeah, and then I'm sure it has turbo cancers connected to it too, because,
well, it does. I had a lab. This was one of the worst cases I'd seen that I actually worked on in person. And I mean, this guy, it was a, a gay couple. They'd moved from LA out here to Florida. And I mean, this dog was this guy's emotional support dog, this yellow lab. They went in, and the yellow lab ended up on its second or third shot blue with enlarged lymph nodes, generalized lymphadenopathy all over, all the peripheral lymph nodes. And so they went in. I said, you need to get it aspirated. So they were working with a conventional vet. So I'm like, it was right around Christmas. I was going to be out of town. So they went and got the lymph node aspirated. And when I got back, they had already been sent to an oncologist. And I was like, let me read the lymph node aspirate. Well, it was inconclusive. They didn't
oh,
even find they didn't find abnormally sized lymph nodes. So I said, why wasn't, did they send? did the oncologist re-aspirate it to see if she could get a better sample? And did they send it off, if you're assuming lymphoma, whether it was B cell or T cell lymphoma? And they're like, no, they just said it was most likely lymphoma, so we're going to start the chemo protocol.
Oh, so they just jumped to conclusions.
They didn't get a definitive diagnosis on this dog. And so I go all the way back through all the records of the dog. The dog had tested positive for Lyme after being up in New York State like 5 years ago. And so
Okay.
here I am going an immune system case with Lyme disease history, and it had been put on doxycycline, but it had never been retested.
Yeah, so a
And all these lymph
subclinical.
nodes. Yeah. So I'm thinking it could have reactivated the Lyme in the dog and gotten the lymph nodes. Well, then I told them flat out, I said, you can't just start treating this dog for chemo without having a definitive diagnosis. And they said, well, we're going to go back up and see the oncologist and da 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 da. They walked into the oncologist, and the oncologist said, oh, your dog's walking so poorly because of the Librela. The oncologist gave a third injection of Librela to this dog, and they brought the dog back to their apartment, and they called me up going, something's really wrong, something's really wrong. And I go over there, and the dog was dying. The dog was dead by midnight that night.
Oh my gosh.
And yeah. And I called up the oncologist and spent a good hour on the phone asking her where the chest x-rays were, the ultrasound was, why there wasn't a second um, aspirate done. I just grilled her. And it was a young oncologist. She was like, oh, da da da.
Oh.
It's unbelievable, Poppy. I just,
It it makes it makes me so angry. I
yeah, yeah.
like this makes me want to
Well,
go to vet school. I'm like, and
but
I
I mean, as
don't.
a vet, I'm sitting here talking to my colleagues, like, and it just, that's why I'll step into the ring for a little bit and then I'll have to step back out. The first people that contacted me was a guy out in Oregon. He was sitting with his dying dog after Librela. And then Lita, who she's running a nonprofit also that needs to be mentioned called Pause Over Profits, and she's an attorney and she's fighting because the thing is they've got other products down the line. They've got supposedly a Librela is giving once a month. Supposedly they have Librella's sister that will be one injection will be good for 3 months, that they were going to start releasing in Europe. I don't know if they have, because their stocks have started going down. Every time their stocks go down, there's a big party on the Facebook group. But you know,
That's hilarious. Oh my
I,
gosh.
yeah, people need to understand this because there's other products coming down the pike very similar. And I'm just telling my clients that if you go into a veterinary clinic and you're not sure of something, don't let them give your dog anything until you go back home and do some research and get some second opinions. If they insist in its emergency, tell them I don't want something in injectable form. Give it in pill form, because if it's in pill form, you usually have like 24 to 48 hours and it's kind of out of their body. So you can detox from whatever medication it is. Whereas in injection, which all these biological products are in the form of injections,
They go
once it's in your
systemic.
dog, you're not going to get it out. There's no detoxing from it. It goes in there and it does the damage.
So Dr. Heather
Unfortunately.
O'Leary's saying, why can't we just do regenerative therapy? He's like, why is nobody weighing the value of this?
Well, I mean, I'm sitting on the sidelines with the peptide thing, quite honestly. 'Cause those are proteins. Those have the potential, again, to stimulate that immune system, especially if they're man-made. And I think most of them are man-made. So I'm just sitting on the sidelines with that. I know some people have seen a lot of really good results from it, but my thing all the way along going, and I don't know, I was lucky because I think I was one of the last generations of vets that got out of vet school that actually learned some kind of science.
Well, and
I
it
studied,
sounds like it Dr.
Yeah,
Josie, it sounds like common sense is not being
yeah, and
taught.
I worked with the Ronald Schultz, the immunologist, was my immunology professor,
Oh,
and
wow.
then I worked with a lot of old-time vets. In the days before, you didn't have blood work, you didn't have X-rays, let alone CTs and MRIs. You had to learn how to observe that animal and see what's going
Right.
on, you know, which is a
Right.
different way to practice. But
So, how effective is acupuncture? Because you are a Chi Institute instructor and you are a premier acupuncturist. Is it
for
for
acupuncture for what?
Librela?
Librela. I've treated several different cases, probably quite a few good Librela cases with it. Right now I've got this gorgeous sweetheart of a black German Shepherd, and he, after his third injection, he looks like a dog shepherd with degenerative myelopathy, or he has a roached back that looks almost like a herniated disc. But when they do x-rays, now he hasn't had any x-rays done in the last 2 years, but I had them get initial x-rays and there were no changes in those x-rays. But his gait is totally messed up, but we've stopped it, we've halted the progression of it.
Oh,
So
wow.
he still goes on like mile-long walks, and he eats, and everything else is doing pretty good. And I do acupuncture every 2 weeks on him. So I think it does, because it's stimulating the body's repair mechanisms, right? That's how acupuncture works. And with electroacupuncture, especially for spinal problems, they found that it increases stem cell activity
Oh, that's so
in the nervous
interesting.
system.
We
Yeah.
used to do that in the horses, like back in the 90s, is
Hmm.
clipping a little
Hmm.
electricity to your needles and gunning
Yeah.
it.
Yeah. Yeah. Yeah.
Yeah.
I do that on a lot of patients. So, yeah.
And so it actually activates stem cells.
Stem cells.
Huh.
Yeah.
What
Yeah,
else
there's a natural
activates stem
innate.
cells? Like, can we do PRP or um, stem cell
Well, I mean,
therapy?
you want the immune system to calm down, and you need that nerve growth factor in there, you
And what
know.
about like FMTs? Could that also help the body
Oh
like
yeah,
regain
yeah.
some
Yeah.
productivity on that?
Yeah, probably, definitely,
There's got to be a
but,
better way
but
because it's a dismal,
it
degenerative
is.
outcome.
It is. Now, some people they've nursed their dogs through, and I mean, all these things that we've mentioned are all modalities that I recommended on that list. But and some dogs have nursed their dogs through, and they've gotten through it. Especially if they just have the increased urination and
There,
drinking and the hind limb ataxia and stuff, sometimes they'll pull out of that. And then I'll do kidney support, nettle seed extract, and things to support their kidneys, and that, anything that I would do in a dog with glomerular nephritis. But the weird thing is the neurological exam on these guys doesn't make sense to me. It's like if it doesn't follow the rules with other neurological diseases. And
like
they'll get this it's doing and I've tried to get through to Curtis Dewey on this, but nobody understands what I'm saying. But and that may be because I'm so intuitive too, I feel like there's little x-rays sometimes on the tips of my fingers, but it's doing something at the neuromuscular junction, because, oh, this is the other thing, they will exhibit rapid muscle loss because
so,
that
so it
nerve
must
growth
attack
factor.
the fascia.
Well, I think it's in the fascia, but I think it's at the neuromuscular junction, because if the nerve is no longer stimulating the muscle fibers, then the muscle fibers just wither away. I've seen dogs within a week. I'll go back to see them a week later, and it's like just muscles dripping off of
Total
them. They have
atrophy.
such bad atrophy. It's so bad. And then the other thing is they'll get really stiff and dry, like a severe, severe blood deficiency in TCVM,
Wow.
where their fascia gets almost crackly. Like you try to do, I'll do a lot of skin rolls up their back, but it's like it's crackle paper underneath your fingers, which it's disturbing, and they'll be really stiff, like they can't, like they're just locked up stiff.
Oh my God.
It's Yeah, it's not
So,
fun.
so Jill's asking, are all stem cells good cells? It depends on where you derive your stem cell.
Well,
So,
yeah, and I mean, stem cell therapy, I feel like we're in the very beginning of that now too. And you don't know how an individual dog's going to react to a stem cell. I wouldn't, because there's such a weird immune system thing going on in these guys. I think piling other stuff in on top of it, I don't know. I think you're asking for trouble in
I
some
know.
ways.
So we've been doing stem cells in the equine field for years, and it's been
Yeah.
amazing. But now they do the equine embryonic stem cells for horses, dogs, and cats,
Yeah,
which
I've
I
seen
think
that.
is really interesting cross species from a herbivore to a carnivore. And so I don't know if there's
Huh.
anything we should consider with that. Horses don't get cancer very much. And so I'm also wondering
Right?
if it could have a natural antibody to cancers.
Kind of like sharks.
Yeah.
Sharks never get
Sharks.
cancer. That's why
Shark
we
stem
used to,
cells.
well, we used to use shark, what was that? Supplement. People were giving it for cancer.
Chitosan, I think it was, right? The
Shark skin or shark, what
shark
was it? Shark
it was
cartilage. Shark cartilage.
it was.
It was
Yeah.
shark cartilage, and then we got away from using it because who wants to go kill all the sharks? They're having a
Well, it
hard
just
enough time.
plummeted the ocean sharks.
Yeah.
Absolutely.
Yeah.
Yeah.
That's what I worry about with krill and all of these things. I mean, we and this is I'm going to be talking at AVMA this fall, but we've got to get back to TC, traditional Chinese veterinary medicine, back to the original classic texts, way back, was an ecological form of medicine. There's a reason that Ted Kaptchuk titled his book The Web That Has No Weaver. We are one little dot in this big giant web of life. And there is something called the butterfly effect, and things we do, small things we do, can make huge effects in the ecological balance of this planet. I mean, just look, like, take away nerve growth factor. That's one effect, what we've been talking about. It can have a huge effect. So we've got to get back to a different way of thinking.
All the downstream damage that we've seen from chemical
Yeah.
plants and
Oh,
plastic in the ocean, and
and our food supply, I
it's
mean, we're
terrifying.
down to, I I don't know. We our grocery list is like shorter and shorter and shorter in my house. I buy vegetables from an organic community supported farm, and we're eating lots of meat here, but it's getting smaller and smaller and smaller what we'll put in our bodies.
Yeah,
Pretty
no, I
crazy.
agree. I'm making myself eat at home way more.
Yes.
It's like
I
you're
I
literally risking your life eating outside. And
I spent all weekend cooking up stuff because our work schedules for the next 2 weeks are really crazy, and I can't eat. If I go eat, I risk, if it has any seed oil in it or anything at all, I'm like sick for 24 hours. I can literally feel it at this point. So
yeah, I can too. It's almost like it
yeah,
makes your blood flow differently.
right?
Your blood
Like it
gets thick.
sludgy.
Yep.
Yeah,
Hmm.
sludgy blood.
Yeah.
Yeah.
As much as I just want to do the quick and easy stuff, I just can't afford that anymore on the health
Yeah.
scale. And
Yeah.
our horses and our dogs and cats get better food than we do.
Right. And a lot of, yeah. Yeah.
Yeah.
I mean, I wish I could just eat Solutions pet food. I
I know.
thought about it.
Chelsea's amazing. We love
I've,
Chelsea.
Yeah, I've thought about it, but
You thought
yeah.
about it. You're like doing the goat's milk, doing all
Well, I'm
that.
already
Sheep milk.
doing the goat's milk. I'm doing raw cow's milk. So raw cow yogurt. We have a place down the street from me that's selling all that. So yeah. Anyways,
Michelle Cummings is saying the introduction in the book and Immense World by Ed Young perfectly captures the butterfly effect. Also, Our Stolen Future. So, Our
yeah.
Stolen Future is about how biologists were seeing animals with like multiple sex parts, hermaphrodites, and
No, I
more.
saw him. When I was at the Humane Society in New Mexico, well, we were right outside Los Alamos, was up on the nearest mountain range, but I saw hermaphroditic, all different kinds of hermaphrodites because I was doing so many spay and neuters. Yeah, it was really wild.
So you cut into them, you're like, oh, multi.
Yeah, or there'd like, yeah, there'd be
How do you spay
testicles
and
in
neuter
there.
at the same time?
You take out, well, the testicles would be like intra-abdominal. I'd be in there looking for an ovary, and then all of a sudden I'm like, this doesn't look like an ovary. This is a testicle. Because the testicles that originate up near the kidneys and adrenal glands and migrate down into the
The
scrotum.
the gonads are identical
Yeah,
for, yeah,
yeah.
not
So,
wild.
yeah,
That's so weird and scary all at the same time. Yeah,
yeah.
you guys eat at home.
Yeah, I just, yeah.
I've been really convicted about that and really trying harder. And every time I like focus and make myself do it, I feel so much better.
Yeah, and then the more you eat at home, then you go out and have a good dinner and then you realize how crappy you feel afterwards. It's really
Yeah. So how can we
but
make a difference in the vet pet space, Dr. Josie? Like, I feel like it's screaming at a
um
wall.
it is because there's so, I don't know what has happened, and I feel like it's a veterinary school education. They were taught a certain way, and get so defensive. I mean, I teach them when I'm up at Chi University. Well, that was the other thing. I teach. I have a group of 5 students. Last time I taught mixed animals, so I had 2 groups of 5 students. Now, the older vets, there's just a different thought process that goes on because they're not taught the clinical reasoning that we were taught in school, like the SOAP protocol and how to approach a case, gathering your data, and then coming up with differential diagnoses, and then figuring out how are you going to weed in and out the differential diagnoses. But they're taught an algorithm. So it's like, is the dog vomiting? Yes or no? Does the dog have diarrhea? Yes or no? Does the dog this? Yes or no? And so there's these little flow charts, but that can get you off track into the wrong diagnosis very, very quickly.
It's too linear.
It's very linear. So you already cut out like possible diagnoses right off the bat. But then they get really threatened. I mean, I've spoken to vets. I've with my clients, I tell them, I'm like, if you're in a clinic and you need to talk to me about something or ask me, and it's during business hours, I will talk to you. So I had a client, this is just a really simple thing. Standard poodle puppy, 6 months old, took him up to New York to run around in the woods and have a good time with their other standard poodle. The dog came back and developed this swelling on its neck. So they took it in and they put it on, one vet put it on antibiotics and the swelling went down. Well, like 3 days later, the swelling came back up and it seemed to be larger. So he got on the phone with me. I said, it's probably an abscess. They were running out in the woods. He could have gotten jammed by a stick in his neck. Who knows? Bit, whatever. So they go into the vet and they're like, instead of, I said, can you just have them aspirate it and find out what's in it? Well, the vet aspirated it, found pus in there. And then I was telling the client, I'm like, well, did they just, for an
Drain it.
abscess,
Yeah.
drain it? You can clip the hair, clean it up. You can flush it out with LRS and put a drain in it to keep it open so it doesn't fill right back up and fix it. Oh no, they couldn't do that. So I got on the phone with a young vet. He was at the clinic and I said, "Can you just, since we know it's filled with pus and we know it's an abscess, can you go in and drain it, sedate the dog, clip the hair, make an incision, flush it out?" I told her the exact procedure. Oh, well, we're actually waiting to consult with the medical team and the surgical team. Now, the surgical team, this was like a Friday, the surgical team won't be back in the clinic until Monday, but I'm sure when they come back, the surgical team is going to want to do a CT scan on the
What?
mass. I mean,
On the mass. Oh my
it
gosh.
went from a simple procedure that could have been resolved into this big nightmare. So I told, and I was on speakerphone with my client and the vet, and I said, "Listen," I said, "you need to take your dog to a different clinic." They were up near Toronto. I know a holistic vet. I'm there. I'm like, start making phone calls and everything. They could not find somebody who would go in and just drain the mass. So at this point, he was so frustrated. He's like, "Josie, I'm back on a plane and I'm flying back to Miami because you're there." And there's another conventional vet he was working with. By the time he gets back, the mass has turned into like a small abscess, pus all the way up to the edge of the
Oh
dog's
my gosh.
chin. So they have to send him over to a specialist. Well, I read the surgical report from the specialist, and it was almost word for word what I told the veterinarian to do to fix the
Oh my gosh.
abscess, including putting a drain in. When I told her to put a drain in, she said, "Well, that's antiquated medicine. We don't put drains in anymore." And I
Oh
said,
my
"So how
gosh.
are you going to keep it open and keep it from filling back up with pus again?" So the specialists down here, they ended up paying $10,000 to go in and get the mask. And talk about frustrating. I was thinking, I'm like, can I get on a plane? Do I have enough sedation drugs to go up there, sedate the dog myself, get a scalpel blade, take fluids with me, and just go do it? You know?
Well, and you could have done bentonite and Hapar and
But
Silicea or
well,
something like
this
that.
was like it was actually a really they did culture it because I did have them. I said culture it because it was a really, and it turned out to be this really weird bacteria that's found only in like mice and lizards or something. So the dog was bit, obviously, by something. So I mean, it was a nasty infection, but they could have taken care of it if they'd done it right off the bat and not gone through all that,
That's so
you know.
wild. What a
It's
nightmare. This is, gosh, Dr. Josie, you really like brightened my day today. I just want
because
to,
I still have,
oh my
I mean,
gosh, this is so depressing.
I still have one foot in the practice realm, so I'm seeing these cases, and it's just like, what is going on? You know, I and that's one thing I'm concerned about. I had one case, they can't recognize bloat in a dog on X-rays or pyometra. I'm
Well, they
scared to death.
send vets send their x-rays out now. They don't even read
Yeah,
them. And so
no,
you're
they don't read
waiting
them.
how many
Yeah,
hours for them to read an x-ray? You can't do that on a bloat.
no, no, you
Oh
can't.
my gosh.
You can't.
And that's a
So,
horrible death. Yeah.
yep, yep.
That's terrifying. Yeah, I get so annoyed. In fact, I do an x-ray day where I throw up x-rays in this group and everybody loves that because they get to like stare at
Oh, that's
x-rays.
cool. Yeah.
Yeah, and they love it because I am afraid of those darn x-ray like farming out x-rays and waiting. And I've seen the
Yeah.
farmed out x-ray technicians miss stuff.
Oh, yeah. On my cases, I tell them they have to send the X-ray images to me. I always double check.
Yeah.
They'll overlook things like spondylosis of the spine because they're just like, oh, it's just a incidental finding. So you have a big bone spur in your spine, and that's an incidental finding,
But they
you know?
don't tell you that there's this massive bone spur.
No.
And if you didn't like
Yeah.
review it, I mean, it
Yeah.
still means something. That dog's living in pain. Come on.
Yeah.
Or a cat. Yeah.
Exactly. Exactly.
I think
So
it's so
it's pretty
strange
wild.
that dogs and cats behave differently to the Librela type of toxin. I don't even know what to call it. Drug product.
Well, they still get, I mean, cats, their kidneys get really impacted by it, because they have such sensitive kidneys anyways.
They don't
So
detox as efficiently. Why is that?
they don't have the same cytochrome P450 enzyme detox pathways in their liver. So there's some things that they can't detox.
I
But
didn't
they're
know
they're
that.
master healers. I have a black cat who's my like soul. She's my familiar, and she's been I'm live on Facebook talking about all this stuff. She's been in like her third body with me, but she came in this was back in the fall, and she came in all ataxic on her hind end, like she wasn't paralyzed, but she was walking complete neurologically, and I have a big fenced in porch, and I think she crawled up after a lizard and fell and injured her back, either with a herniated disc or something. So I did red light therapy on her. She let me do a couple acupuncture treatments, but
Oh,
after like the
wow.
third or fourth, she was like, I'm not having it. So I did Moxa on her because it was in the winter time and it was cold. And
What is that? Is that with the
it's a
sage?
burning, yeah,
Hmm.
the sage, yeah. Um, so she posted herself up on a pillow on my bed so she would be out of the way and not jostled by the dog or anybody. And that cat healed herself.
Oh,
I've been like nursing her and everything and making sure she's on good food and all the yummy stuff. And I've got her on some kidney support and some Chinese herbs. It's just like microdose Chinese herbs,
right.
you know.
Yeah,
But
there's a fine line between love and hate on that.
yeah, but cats have 9 lives, man. She literally healed herself. I've seen cats with broken bones heal the broken bones.
I actually believe broken bones are easier to heal than tendons. I've had so much
Oh,
more
they are,
success.
yeah,
Yeah,
because they have better blood supply. Like tendons and ligaments are really tough.
they are. They are like pieces of rubber.
Yeah,
Yeah,
yeah.
they're such
And they don't
weird
have
texture.
they don't have the blood supply going into them like the bones do.
Yeah.
But,
Hey, I'm going to open the
so
floor for anyone who wants to ask you questions. Are you cool with that?
sure,
Are
yeah,
you up
sure,
for it?
sure.
Our depressing combo. Thanks, Dr. Josie. I really
I mean,
appreciate
sometimes this allows me to, I live with this every day, and it's just like,
How do you do that? It's so
it's,
awful.
yeah,
It's just, this is why I never
it's
wanted
depressing.
to be a vet.
Yeah.
Okay, you guys, why am I not seeing the gallery? Do you guys
Let
all
me
have
see.
your videos off? There you
They
go.
all have their videos off.
Do you guys want to ask questions? Maggie, did you want to get in there? And
Go for it.
Kathleen.
Go for it.
Kathleen, you look like you're haunted or something. It looks
Yeah.
the shadow on your face. Wait, wait, wait. Talk to us, girl. Are you going to unmute? You're still adjusting.
That's fine.
I'm adjusting. I don't have any questions. It's just fascinating. It just boggles my mind
It
that this
Yeah.
stuff is allowed and passes. Anyway,
Yeah.
right, and it's been known and it's swept under the rug and nobody's getting spanked or slapped
Yeah.
for like
Well,
using animals.
and the fact that veterinarians, they get almost defensive over defending Zoetis, it's just amazing. It's this weird form of brainwashing. That's the only way I can say, because people are like, well, why didn't my vet say everything you're saying? And it's just,
but I've noticed this lately that like human medical care and like you were talking about the vet care, like they can't even drain a wound.
yeah,
Like I mean, I never
yeah,
rarely
That's
see a
just
doctor, but my
basic.
friends go and like they just don't get proper advice
yeah.
or treatment, and they have no I they refuse to do their own research. and then they just go get another pill and they don't even realize that something is amiss.
Yeah.
I find it
Yeah.
frightening. It's like, did COVID vaccine shut all your brains down or something? Like,
That there's something to that. And I have more conversations about that there is like a lot of people are talking about that. They're just it's like this weird
Like
like they're
a
behind a
zombie. It's a zombie type
yeah.
thing.
Like they're behind a plate of glass and you can talk to them and you can hear them, but they're not there's this disconnect, you
yes, there's
know?
a disconnect.
Yeah. And here we carry around these things in our hands that are mini computers. And we have
Right.
all of Google and all of AI at the tips of our fingers 24 hours a day. Look up your drug. Now it's hard to do because you can't go with the first 10 results. You got to go down to like about page 4 or 5
Oh,
to
wow.
really find the information. Oh yeah, they scrub. I was looking up something the other day. I forget what it was, and they scrub the
Isn't that
internet big
wild?
time.
We live in such a dishonest media world. So, Bill Gates did a weather experiment in the Bay Area, and it made it snow here like 2, 3 years ago. And I
Whoa.
screenshotted all the articles, the news articles, and I literally called California State legislation. I sent emails. I am
Hmm.
1,500 feet, so I'm below the typical snow line. It was April, and it was
It's
hard on the
snowing.
plants, and it snowed here. So all the newspapers that did digital print, I had screenshotted. Can't find any of those articles
Yep.
anymore, but I have them
Yep.
screenshotted, so I know they existed.
Yep.
Yeah.
I did that when COVID started. I found the original research articles from the lab up in North Carolina, and there was a lab out in Stanford, and there was an attorney, I forget his name, he's dead now, but surprise. But he came out right at the beginning. He's saying he worked on the 1998 biological warfare treaty that was signed globally, and he's like, "Listen, guys, these are the labs this has came out of." And the one lab was the last paper published from the lab in North Carolina. And the very bottom, it said, this will be the last research we publish out of this paper because it was gain of function research because Obama has put a moratorium on our research and we're going to Wuhan, China. I mean, it said that I've got the paper saying
Wow.
on the bottom, and this was right
Whew.
as everything was happening. Like it, it's not, yeah. So.
Yeah.
And
It.
science is not what science used to be. I mean, science was meant to question everything, and you question and you keep questioning and you keep questioning, and you dive into it. Well, maybe that's right, but you just don't take things at face value, and it's no longer like that because there's so much money involved.
I
The
have a
money is,
girlfriend who is a cancer researcher for humans, and she worked for a big corporation. And her team didn't falsify the results, but somebody within the organization did, and they are no longer existing. But you
yeah,
spend a lot of
yeah.
money developing something that fails, they just won't take no for an answer. They'll find a loophole to fake the stuff.
And veterinary medicine is a perfect, oh, just send it over to them. Look how much money people are spending on their pets. You
Right.
know,
Yeah.
yeah. There's for me, there's some heavy, heavy karmic debt that's gonna be paid. That's,
And Heather, I'd love to read your comment, but I don't want to get in too much trouble. Oh my gosh. Go check on the comments later, Dr. Josie. Yeah.
or
Um
are they
it
on your
it's
in the
the
chat?
Holistic Animal Insights business
Oh, okay.
page. So I piggyback on the business page and then the
Oh, okay.
membership page. So you
Okay.
can,
Yeah, because I can't see the comments on here
yeah,
in the chat. Oh, that's why. Okay.
Um, and Michelle Cummings. I don't know if you know Michelle. She's from Australia, so she's hanging out
Yeah,
with
her
us today.
name's sounds familiar. I think I've
Julie,
seen
do
her
you
name.
have any questions?
Julie's heard all of my
This spiel,
I was
I
just gonna
the
say,
know.
I'm with
spiel.
Josie every Tuesday, and then we talk a lot. So I've
Yeah,
heard it all,
Julie's in
and
your
then
private
some.
group. That's awesome.
yeah, yeah,
You've been doing this
yeah.
a long time.
Who?
You, Dr.
Me?
Josie. Oh,
Yeah. Well, I mean, I walked into when I was in veterinary school, I became president of our student chapter of AVMA. And I would bring, this was like in, I went to vet school from 1994 to 98. And so I invited like Christina Chambreau in and Pedro Rivera for chiropractic care. And all of these people, I would have them come for workshops into the vet school. So I'd get up in front of like 80 farm boys from Wisconsin and say, come to our lunch meeting to learn about homeopathy today. And
and
they
would
looked
they?
at me. Some of them would,
Oh,
but
good.
here's the deal. I come from my family were ranchers up in South Dakota, so I know how to deal with the whole cowboy thing and I would get along with them. And then I became really, I got a job in the ClinPath lab. So I was the person that doctors would call to come in and do their emergency blood work.
Oh,
So I always showed up, I was always there. So they respected me for that. So I learned how to gain respect and then I could slip all this other stuff in. But we had 3 years in a row, we had a holistic veterinary medical conference at the vet school
oh, that's
with like
amazing.
3 days. Yeah, it was amazing. 3 days of workshops and everything else. So
We need that more. I know UC
yeah.
Davis, I think one of their vets just bought an ozone machine from Dr. Jill Rubin and
Oh,
came
that's
over
good.
for training, so I was really impressed with that.
Oh, that's good. Yeah.
Yeah, so they they want to know, I think.
Yeah.
Well, it's the older people though. Yeah.
Yeah. It's kind of interesting. Some of the younger ones, though, I'm getting a lot. They're they thought they were going to vet school to like heal animals, and I'm like, that's why well, Avma got a booth set up at the big veterinary conference because I'm like, we've got to start getting these young vets who are still in vet school interested and show them that there's other ways to do medicine. And I also teach that there's a house call veterinary group
Oh yeah.
for house call veterinarians because that's one way that young vets who are coming out of school can create their own practices without having to go $1 million in debt, because you can do it without having all the equipment and get out on your own and practice how you want to practice.
Well, and
So I
if you're
teach it that every year and
yeah, and
yeah,
if you're doing chiropractic and all those
yeah,
alternative
and
therapies,
acupuncture.
a mobile unit actually kind of works for that.
Exactly, exactly.
Yeah.
So
Yay. Well,
So at
yeah,
BMX at the veterinary
yeah.
conference, um, I was at. Ooh, where did I go?
Yeah, I didn't make it.
I was at the gym for dogs with John, who you still need to interview,
yeah.
and he's very big proponent pushing, holistic practices. He's got a whole website dedicated to it and the whole bit. He had Judy Morgan, as always, at the booth signing books, and we had shitloads of students and vet techs. And we'd start talking like, do you know Judy Morgan? No. Are you into holistic? Well, I could be. Come on, walk him over. And then Judy would give him a little speech and sign the book. We gave out hundreds of books and
It's
we got a
great.
lot of people really interested in it. We were handing out flyers to the Chi Institute. There's so many like vet techs and young vet students who want to learn. And
Yeah.
That's
Judy
And
told
that's
exciting.
where to hook
Melissa
them
from
in.
AFMA.
Yeah.
Yeah, and Melissa, we spoke to Melissa, and Judy said, I'll go to any school, anywhere, and I'll go talk. So they were starting to talk about how she could get on the road and start doing that. So, and we're going to have her again at Global, and obviously she has her event. But if more people were doing things like that, you probably get more of the students, and because there was a
Yeah.
lot of interest. It was scary how many of them were.
And you're going to be a guest
Yeah.
speaker at AHVMA.
Yeah. Yeah.
And so Jill's asking if I am going to AHVMA. It's in San Diego this year.
Yeah. Yeah.
So there's no reason for me not to go.
Yeah.
Yeah.
Probably be
You
there,
should
depending if I can
definitely
figure
go.
out how I can get across country with my girls,
Yeah. Jill's
possibly
like, get
a
a
third
pet
girl.
sitter. The pet sitter is always the
I
problem.
can't.
Well,
No, the
yeah,
problem
you
is
had
that
that horrible.
Judy, between all her herbs, from her allergy issues, which may be better by then, and round the clock eye drops with 3 different eye drops, I could go for a week maybe, but not 2 weeks. And I have to
You
go to
just,
Feed Real too.
you need
So,
like a glamour truck. You need like,
well, I'm looking at camper vans actually.
no, you
Don't
need like
laugh.
a
I figured,
concert bus. And
Yeah,
then
get a concert bus, and then I could ride out with you. We
and then
should
it
do
could
like
have
we
like a
could do a
hey, you'll
disco.
convoy
ride out
it.
with me. I'm game if you want to ride out together. I just don't want to do it alone. It's a
Oh,
long
that's
drive
true, you
alone.
two Floridans.
Yeah, we're both from Florida. Yeah, I mean San Diego. I drove from New Mexico to Florida. It was like a 4-day trip with the animals,
Wow.
It's a long
Yeah, it's
trip.
going to be like 5-6 day trip for me, 6-7 hours a day. It's a lot alone.
Julie, I can see your leg cramping now.
I know already.
The
Take
I
your
numb
know.
leg, you're like, oh
magnesium.
my gosh, I can't feel the pedal anymore. Oh my
Have
god.
your
I know.
magnesium foot Epsom salt foot bath with for
That's
your foot
hilarious.
while you're
You're like
driving.
doing
Red
Mag
light.
Boss on one
Red light.
side.
Hey, I thought about putting my red light mat just in the seat of my car and just
You
turning
probably
it on
should.
while I'm driving
I just
because
got the
I
bell
drive so
boots
much.
and I've been wearing them all the time. I was on whose meeting was I on? I was on somebody's meeting the day and I had it around my neck and they're like, you're glowing. I was like, yeah, I'm doing red light. The little bell boots are perfect around my neck.
Oh,
And I keep it on my back.
oh,
If you turn them upside down, you can put the ends like tucked into the bottom of your pants and then it stays in place. I love the
Well,
oh.
and
bell
you
boots.
can
They're
do
That's an
super cute.
idea.
PEMF. You can do the Beamer leg boots while you're driving
Beamer,
too.
yeah.
You're like, take that.
I just
Our
don't have
our
candy on
long
them.
hauls, you guys, we don't bounce back like we used to.
Right?
Oh,
I
please.
know.
1 month and I'll be 70. I'm like over it.
That's so
Oh
weird.
man, I'm looking 60 in the face, so
I'm like,
yeah.
I feel like
62 is
so old
coming
now.
for me.
I'll take 60 or
It's coming
62
up.
any day.
I know. Everything you just change. Your view of life changes. It
I
Your
starts
know. I'm like the
shifting.
part, like,
priorities, your abilities,
Yep.
like you really have to think, okay, am I
It
capable of doing this? And how
it's
much
it's
time is this going to take?
conserving
well,
that
that's why I'm
kidney
like,
jig.
do I really need to go to California beyond the networking? Because what am I going to do? Make $100, $200, spend 10,000 to get there? And
Yeah.
for what?
Yeah.
It's just really more social than anything. But
Yeah.
it keeps you going too at the same time. But
I
I'm
mean,
like
if you can
rethinking, like,
fly your
here,
dogs, fly them because I think that's
Yeah, why not
a
fly the
crazy
dogs?
long trip.
I was thinking it's probably cheaper for me to get the doggy nanny that brought me Candy and have her take Candy and I take Gigi and we fly together.
Yeah.
I've
I just,
flown,
and I
somebody
was
hired
thinking of
me to
that too.
fly a dog to New York once, and that was great. I love that. From California
So
to
I
New
don't know.
York.
I have time to figure it out.
Yeah.
Who knows? Maybe I won't be working for
I love that
Jackie then.
idea, Julie. I think
Of
that's
what, the
really
doggy?
great. Like, sponsor somebody's flight. If you buy it soon enough, it's going to be way cheaper than a bus.
She's $500 to fly dogs around the country. So whatever it is, here's $500. Take Candy from me.
That's so
Is that
crazy.
what
I
she
didn't know.
charges? Oh,
Yes,
wow.
that's what she charges the breeders. So we're good friends.
I didn't know that was like a career.
Oh my gosh, the poor girl, she flies every morning from Fort Lauderdale, typically to New Orleans. The breeder meets her at the airport, passes off the dog, then she ends up like here, New York, Chicago, wherever. And then she flies
Wow.
home that night and back on the plane the next morning. She's crazy, but she loves
Maggie,
it because she's with
Maggie,
dogs
that
all
Whoa.
could
day.
be you.
She's
That
with
could be
dogs
your
all
new
day. She
career.
loves it.
Jet setting dogs.
Yeah, there you go.
That's fun.
And
Huh.
she's great. She's a great person. And she's like 3 or 4 dogs down in Fort Lauderdale that are her own. She works
Wow.
for mostly our breeder, Candy's breeder, but with a bunch of other breeders too.
Oh my
Mm.
gosh.
And all she does is fly little tiny 2.5 pound, 3 pound dogs around.
We need to fly to
Wow.
France. We need some dogs that gotta go to France, you
Right?
guys.
Yeah. France is on my bucket list.
I love France.
I have not been.
Oh, I
Oh,
haven't
it's
been
awesome.
either. Why don't we need somebody to set up a
A holistic
holistic
conference.
animal conference there. Yeah. Because
Let's
I
reach
might be
out to
going to,
Connor and all of those
yeah.
guys and see if they have French connections.
Well, I might be going to UK next
Are
year, next
are you
spring.
doing their UK conference?
Yeah.
That'll be
Yeah.
so fun.
Yeah.
I I need to
Birmingham.
travel more while I can.
Right?
Yes.
Yeah, I went to Ireland this past summer, but it was traveling is different now, man. And the way those airplanes, you don't have any leg room. I got off the plane after flying. It was a 8-hour flight from Ireland to Chicago, and I got off with such a bad leg cramp I couldn't even walk.
I can't believe it's that short of flight.
You have to fly business.
Well, yeah, if you have the money, right? I mean,
Your body's
nice.
worth it. Trust me.
I
Yeah,
actually had a
after that.
Jetta. I had to sell the Jetta because every time I got out, I was like, "Oh my gosh!" For the
You,
first like so many steps, I'm all, "No more bucket seats. This isn't working. Too
yeah,
deep. Hit the
yeah.
sciatic nerve." I was just, or the femoral nerve. I don't know. It was bad.
One of
Too deep.
those, yeah.
It was closer to the femoral, so it must have been. Yeah.
God,
Right.
yeah.
Well, Dr. Josie, any parting words for us about how to like help pets that show up
Um,
on our doorsteps and the
just I
symptoms?
mean, get the word out to people and do your research. Do your research before you give your animal anything right now. You know, they just
Don't
here's
be
it's
pushed and bullied, one thing,
don't be
because they
pushed and
bully.
bullied, and yeah, and do your research, because here's the thing, it's gotten so bad, honestly. Like, I used to think antibiotics and prednisone were the evil of evils. I will take a dog that's been on antibiotics or prednisone any day of the week right now because I know how to get them back into balance with it. But some of these other things, Apoquel, Cytopoint, had two dogs in the past 5 years overdosed on methadone in the emergency clinic because they're using ultra strong opiates in emergency clinics, and they don't know how to recognize respiratory depression from opioid overdose.
That's
I'm jaw
frightening.
dropped.
Don't even, yeah, I just can't even. So I
What
tell
is the brand
people,
name on that?
I don't know what the brand name of methadone is, but I just tell people that's again another reason why I say, if ask, say, make up something. Say my dog's super, super sensitive to opioids, and can you give them an oral dose instead of an injection? Yeah.
Okay. Well, that's wisdom.
Yeah.
And how do you repair prednisone, like steroids? And you
Steroids,
see
but the
the
body,
steroids in the iris, like it shows up as pepper throughout the
as
whole iris.
pepper.
Hmm.
Uh, well, it sends them into yin deficiency and false heat. So you can literally, it takes a long time, but you can, I use Chinese herbs are really good for that.
So
You
blood
know,
cleansing. Right.
yeah, and
Yeah.
yin tonics. Yin tonics. I go into Chinese talk. So yin tonics are gonna the yin of the body is what cools the body down and allows it to relax. Whereas when you talk to people who've been on like prednisone, it's like they're climbing the walls and they have all these false heat signs. So
Okay.
yeah,
Good to know.
yeah.
Whew, girl, doing a good job. We celebrate you.
Well, thank you. Thank
Cheers.
you. Thank you for having me on here, because some people don't want to hear it. It's so, the blinder thing is just,
Well, and I was seeing in the iris and I didn't know what to tell them. I was like, go find the Facebook group,
so
which
it was
I
like
didn't
just
know.
severe toxicity. Is that what it looks like?
Yeah, it
Or
comes out as detox organs are totally congested. So the liver, the kidney,
Mhm.
even the metabolic, the lung suppression,
Yeah.
spine.
It's
Like
probably
it's
from those
just this,
immune complexes
yeah,
forming that are just clogging everything up. And then the body's just in this like, fighting off and,
super mottled eyes, super toxic eyes, and
mm,
the set that I saw, I was like, how bad is this dog? And they're like fighting for its life. And so, and she didn't know it was Librela.
yeah.
She was
No, it
told
can't be that. It
yep,
can't be
she was
that.
told it wasn't that. And I was like, "Oh, honey, let's get you in that Facebook page. Like, I don't quite know how to take you from here to there, but you need to
Yeah.
talk to
Yeah.
you."
Well, like I say, there's a whole like on PetAdvocare. I have listed out like whole protocols, NACs on there, like all the stuff, and they can start there. And then we did like a 2-hour thing. She asked me questions about it, and so that's on there. And then
Cool.
we were working actually with a data scientist. A lot of people stepped forward whose dogs were injured. So a data scientist who's actually still collating global data because of course they don't want people reporting it and they're messing with the data. So this data scientist from the West Coast is working on keeping up the numbers on collating the data. There's
And-
just a study that came out. I just posted on Facebook this week about Solensia because the drug company's like, oh, we've sold millions of doses and these are just like 100 or so dogs, like less than 1%. That's but God,
oh, they're la 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 la.
yeah,
Yeah.
yeah. So
And you can't trust the science. You know, the
yeah,
old the old quote,
the
trust the
science.
science.
The science. Somebody told me that the other day. It was like, yeah, the science. What's whose science?
Yeah. It's
Mr.
not even
Science.
science.
It's not even
It's
science. No.
opinion and it's black black market.
Yep.
It's evil.
Yeah. 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 So we
Yeah.
just keep on, and also just to keep them healthy to begin with, so you don't have to go into the vet. Like
Right.
my
And there's
dogs. I mean,
other
I love.
prevention and
Prevention,
options.
prevention, prevention. And people are like they're like, "Oh, but there's nothing else to treat Librela." I don't know how many times I've heard that. But you know what the sneaky things Zoetis did as they were building up, coming out with this whole thing, they turned NSAIDs into the worst evil thing in the world. I'll take a dog on NSAIDs any day of the week. I
Oh,
put my own dog on NSAIDs the last year of her life. But
oh my gosh.
so now the vets are like, oh, but we can't use carprofen or Medicam. Oh my God, no, it'll kill him. And God forbid you put a dog on prednisone. I mean, I've had 2 cases this last year. They were literally so bad and weak from the arthritis and everything. I was like, listen, we can do this, and they're going to be comfortable, and we can get them on the lowest effective dose. And I had one dog live another 6 months on low dose pred for their arthritis, and
But, you
they
know,
did just
quality of a
fine.
life,
Versus giving them Librela, which is just gonna, God knows, it's playing Russian roulette, is
it
what you're doing.
is.
It's playing Russian roulette.
It really is. It's just like, good luck. Yeah,
Yeah,
and like you said, it's a horrific death, so it's not something where you're like, "Oh, we gave it a go and it just didn't work." No, it destroyed them.
yeah,
So, oh my
yeah.
gosh, girl, have the most
Well,
beautiful week. Thank you for your
thank
time.
you. Oh, you're welcome. Thank you for having me on here, and maybe I'll
I,
see you out in San Diego. Would be
I hope
good.
so. I love San
Yeah,
Diego. We'll
yeah.
we'll eat non-Pacific fish in San Diego.
Non-Fukushima fish.
I lived in Playa del Rey and I would pull computer parts out of the ocean.
Oh,
Yeah, like
shucks.
big cords and computers, and I was like, dude, this is so bad.
Well, I went to visit a friend, actually Becky out. She lives in Santa Barbara, and we're driving up the coast. I lived out in LA my year of college. We're driving up the coast, and I'm like, what in the hell are oil platforms doing right off the coast of Santa Barbara and LA? We don't have those in Florida. I mean, our beaches and coastline look pristine
They are
compared to what I
pristine.
saw out in California with
Yeah, I
all your
know.
regulations out there. Like, what? I was just,
I know. It's super freaky, right? And you're like, "Oh, Exxon Valdez. Let's just see a broken
yeah,
pipe here and see what happens." Yeah.
yeah.